It's 104.8 Channel 4. It's Sean with you this afternoon, and we're going to talk about something important right now, heart disease treatments. Some new developments happening there, and here to tell us all about it is Dr. Amal Lewis, who is a consultant in interventional cardiology at Al Zahra Hospital in Dubai. Dr. Amal Lewis, good afternoon to you. Thank you for joining me.
Thank you very much, John, for having me on the show.
Absolute pleasure, mate. Now, let's just start by maybe you explaining what are the new developments in the treatment of heart disease?
Sean, there's been a remarkable developments over the last decade or so, especially in interventional cardiology. I would say, if you ask me for the two most significant developments, I would say one of which is intravascular imaging. We had imaging technology to see the heart using ultrasound, which has been there for many decades, and then we had CT scans and even MRI scans, etc. But now we have intravascular imaging where you can actually see the inside of the artery in detail using either an ultrasound probe or an optical imaging called OCT. So what it tells us is when you identify a blockage inside the artery, these blockages in the artery is what leads to heart attack. So this particular type of imaging helps us to characterize the blockages, whether it's made of cholesterol or is it made of a blood clot, or for instance, if there are any calcium deposits. See, these information we learn that it's very important during a stenting procedure, because if the blockage is, say, very hard and there is a lot of calcium, the stent, which is a tube that we insert inside the blood vessel, doesn't expand fully, and you will get a suboptimal result. So intravascular imaging has revolutionized angioplasty treatment, and now the outcomes are much, much better with angioplasty to the extent that we don't require open surgery anymore for treating blockages. So that's one major advance in the last decade or so. The second thing I would say is now, apart from treating blockages in the arteries, we can actually replace heart valves without open surgery. I know you must be wondering how it's possible, but just like the angiogram procedure, we go through the patient's leg or through the arteries in the hand, and we can implant or even replace heart valves. And as you know, once you can do this without open surgery, the risks of the procedure comes down, the patient quality of life is better, the patient can be discharged home soon. So we can actually replace and repair heart valves without open surgery. So these two, I would say, are the most advanced development in the field of cardiology.
Doctor, could you explain what CT angio is for us?
Right. Well, traditionally, we use what we call an invasive angiogram to visualize these blockages that I was talking to you about. But now we can visualize these blockages without invasive angio, where we inject the dye into for instance, the brain in the hand and can do a CT scan. However, the CT angio has its own limitations. Number one, the radiation exposure is much, much higher. And number two, the dye we use to visualize the arteries can sometimes affect the kidney, and this can be controlled in an invasive angiogram, whereas in a CT angiogram, the dye consumption is much higher. And finally, CT angio is meant for people with low probability for blockages. When there is a high probability, I would still recommend an invasive angiogram, because you not only see the blockage, you can assess the severity and plan the treatment accordingly.
Fantastic. We're going to talk more with Dr. Amal Lewis, who is a consultant in interventional cardiology at Al Zahra Hospital in Dubai. It's 104.8 Channel 4. It's 104.8 Channel 4. It's Sean with you this afternoon, and we're going to talk about something important right now, heart disease treatments. Here to tell us all about it is Dr. Amal Lewis, who is a consultant in interventional cardiology at Al Zahra Hospital in Dubai. Dr. Amal Lewis, is there any alternative to stents, doctor?
Right. Well, stents, Sean, initially when we did angioplasty procedure, say 20 or 30 years ago, it was all using a balloon. We just clear the passage and we let the blood, we restore the blood flow. But then we had this mesh-like tubes called stents, which actually improved the outcome after angioplasty. But the problem with the stent sometimes is, as you know, being a metal, it has to heal and it causes, although it's very rare, it can cause further narrowing after some years. Now we have a special balloon called a drug-coated balloon, where the balloon clears the blockages and it delivers a drug. In other words, it paints the artery wall with the drug, and this medication prevents the blockage from coming back again, and that is proven to be as good as stents now. And I would say now almost 50% of the angioplasty procedures can be done without stents and just with these special drug-coated balloons. The other advantage is, if you're not leaving anything behind, leave the options open for the future, especially, say, in younger patients. As you know, some of them do develop blockages again in their life, even after stenting or a bypass operation. Whereas if you use this drug-coated balloon, it leaves options open for the future for further stenting or a bypass operation, because nothing is left behind inside the blood vessel.
Okay, and Doctor, just explain to us how we can actually detect blockages in the heart.
Yeah, so we have many treatment to treat blockages, but equally there are certain tests we can do to detect blockages. And I would strongly recommend for all men over the age of 40 and for all women over the age of 45 to have regular cardiac health checkup. And the tests we do to detect blockages on a preventive health checkup number one is a simple treadmill test, where one would walk on a treadmill connected to an ECG, and if there's a blockage, you can detect on the ECG. And the other way we can do it is now we can do the same stress test with a scan, what we call it a stress echo, and the sensitivity of detecting the blockages gets even higher when you use a stress scan. And these are the two simple tests you can do to detect blockages. And of course, for someone with a heart attack or somebody who has a typical heart pain, etc., we go for either a CT angiogram or an invasive angiogram, depending on the patient's age, etc.
It's an important topic, and it's one that you should definitely talk with your doctor about. But Dr. Amal Lewis, thank you so much for the information. You have a great afternoon.
Thank you very much for having me on your show, Sean. Take care. Have a good day.
It's 104.8, Channel 4.